Hello everyone, I am Dr. Meghna. I am a senior consultant obstetrician, gynecologist and laparoscopic surgeon in Birth Right by Rainbow Hospital's Marathahalli. Today, let's talk about fibroids. Let me first tell you what are fibroids. Fibroids are benign muscle growths. Most of them are non-cancerous in the uterus. Now, uterus has three layers. Uterus has an inner lining which usually grows the child when you're pregnant, a muscle layer which usually is a expansile function, that means it expands in pregnancy, and an outer covering layer. Now, from the muscle layer usually there are benign growths called fibroids which may happen. Now, why are we talking about fibroids? Because they're very common among women in reproductive age group, and almost 20 to 30% of women have fibroids in their lifetime. Let me tell you about what types of fibroids could be there. There are three types of fibroid which you can have. One in the cavity called submucosal fibroid, one in the muscle layer which are most symptomatic, which are called intramural fibroids, and one on the top of the uterus from the outer layer which are called subserosal fibroids. Now, let me tell you what are the causes of fibroid. Most research did not find any causes for fibroid, but there are genetic and environmental factors in causation of fibroid. Now, if your mom or grandmom had fibroids, you're more likely to have fibroids. And if you had your periods early, if you have your menopause late, there are certain things which can add on to developing a fibroid. Otherwise, a healthy lifestyle is known to prevent fibroids. Otherwise, there is no pinpoint on what can cause fibroid exactly. What could be the symptoms of a fibroid? Unfortunately, most fibroids don't have symptoms, and this leads to diagnosis very late. But fortunately, fibroids don't turn into cancer and they don't trouble us much. So even if they are diagnosed late, it's usually harmless. What could be the symptoms? One, if it is in the cavity of uterus, it becomes symptomatic very early. You could end up with irregular bleeding or excessive periods or painful periods. Very rarely it can present as a lump coming out of the vagina if it is a long stalk fibroid from the inner lining of uterus. And those of them which are very big can also cause pressure symptoms and fertility issues. Pressure symptoms like when they press on the bladder, they can have urinary problems like frequent urination. Urine could not be passed easily. And when they press on the rectum, which is behind the uterus, they could cause constipation. And most fibroids do not have symptoms. Usually women come to us that they've had an annual checkup and they found a fibroid. Those of them which do not have symptoms, which are usually less than 5 to 8 centimeters, and they are not looking at planning a pregnancy, we do not interfere. We just follow it up after a scan and after an year. Now, how do I diagnose a fibroid? Fibroids, huge ones, yes, on my examination I can diagnose, but very tiny ones are diagnosed on usually a transvaginal ultrasound. A transabdominal ultrasound also could easily diagnose it, but for the location of fibroid and whether it is pressing on any other organs is best diagnosed on a transvaginal sonography. And let me tell you what is the treatment of fibroids. It depends on usually the age of a woman and whether they are looking for planning pregnancy or not. Now, if it is a very young lady with very tiny fibroids, then we do not interfere if it doesn't interfere with her life in the form of heavy periods, painful periods. If there are fibroids, there are certain medical treatments, but if the fibroids are tiny, we do not interfere. If the fibroids are huge, so that they can cause fertility issues or very severe periods bleeding, or it can compress around, then we may ask for either surgery, or there are procedures like uterine artery embolization. We block the blood flow to the uterus. We usually discourage removing the whole uterus for fibroids because we don't want to do any unnecessary surgery. If the fibroid is inside the uterus, then in the cavity of uterus, we can do something called a hysteroscopy. Hysteroscopy means looking into the uterus through a camera and removing the fibroid accordingly. If it is other layers, we usually prefer laparoscopic removal. And as most fibroids don't turn into cancer, we usually prefer not removing the whole uterus. Thank you.